Welcome to this edition of Research Connection. Joining me today is Dr. Adam Eby. Thanks for joining me.
Yeah, thanks for having me.
Tell us a little bit about yourself.
I'm a second year small animal surgery resident here at NC State. I'm originally from the Midwest. Came down here, got out of the snow a little bit, but I did my undergrad training at Iowa State University, and then after that I went straight into a small animal rotating internship at the University of Wisconsin, Madison, and then came down here. So I've been down here since, working with the surgery department here.
Great. And you were recently recognized for your research, right?
I was, yeah. So the Surgery Summit, or the ACVS, which is the College of Veterinary Surgeons, happens about once a year. And so we submitted, Dr. Duffy and myself submitted our research for that. So that was an honor to be presenting there, which was great, and was lucky enough to receive the 1AO award, which kind of is an established grant between veterinary medicine and human medicine, and so they look for projects that kind of bridge that gap, which is great. So we were very honored and very pleased with that award.
Congratulations.
Thanks.
What was the research?
So we're looking at canine tendons. We're doing a lot of research with that. My project specifically was with barbed epitendinous suture patterns, along with a core, just standard locking loop pattern. But the main difference was the barbed epitendinous pattern in and of itself, and how that relates to traditional smooth suture. And so with the barbed suture, the nice thing is it's definitely something that they're looking at in people. It doesn't need like knots or a lot of extra tissue bunching outside of the pattern itself, and so it's a suture that you can place. It has a bunch of barbs throughout it that it grabs the surrounding tissue, and that's kind of how it holds itself in place. And so some of the patterns we did were new that Dr. Duffy has since went on to kind of do more research in, and so we have a lot of branching patterns and various studies also in regards to not only our study, but more studies to come too. Yeah.
Neat. What's a day in the life of a surgery resident?
Yeah, so I would say most days are fairly busy. I think most of my surgery residents, and myself included, arrive 6:45, 7 o'clock. We're checking on all of our inpatients. That could be from 1 to 10 or more, depending on the service. And then we rotate days, so we're either receiving, which means we're seeing new patients or rechecks, and then scheduling subsequent surgeries for typically the following day. And so we go back and forth between like receiving, and then the next day we do our cutting days. And then emergencies fall where they may, whether that's like at 2 a.m. or in between our normal days, and then followed by a little bit of teaching, and then some follow-up at the end of the day is kind of what most days look like.
Glad you were able to fit this video in.
Yeah, no, I appreciate you being able to sit down and chat.
Well, thanks for sharing.
Yeah, it was my pleasure.
Best of luck.
Yeah, thanks.